Hello and welcome to Understanding Alzheimer's and Dementia, presented by Jackson County Library Services. I'm Carrie Turney-Ross, Area Manager for Outreach and Programs. Just a few Zoom reminders. We are recording this program. If you do not want to appear in the program, you can turn off your camera. The only way that you would actually appear in the recording is if you have your camera on and you are unmuted and you're speaking. So make sure that you do keep yourself muted while our speaker is presenting on the topic. And then there will be an opportunity for questions. If you want to ask those yourself, you're more than welcome to unmute yourself to ask the questions at that time. You can also put them in the chat and I can ask those questions out loud for you. Then, and I'm sure everyone knows how to get to the chat, but I just want to remind you, down at the bottom of your screen, there should be a little chat bubble that says chat underneath it. You can click on that and that will bring up the chat and allow you to share those questions or any comments that you have. Now, very quickly, I am going to share my screen. Just want to let you know about some upcoming programs we have and how you can find those on our website. When you go to jcls.org, you can click on this menu button and go to events. And this has all of the events for all ages. If you want to limit your search to just adults, you can do that by going to this filter section and select adults. You can also filter by category. If there's a particular thing you are hoping to find, you can use our categories. And you can also select a specific library to see what programs that library is doing. And then the last thing over here, if you only want to see programs that are happening on site at the libraries, you can select that option. Or if you just want to join our Zoom programs, you can also find our online programs only. And then lastly, I want to show you our catalog. If you haven't looked at it in a while, it was updated back in April and it is very user-friendly. We've got new items, our Spanish language collection, staff picks. So what are the librarians reading or what are they encouraging folks to read? And a whole list of other specific lists, or you can just search for whatever it is that you are hoping to find. We do have a lot of books on Alzheimer's and dementia. So if you want to learn more after, you can always find those books in our catalog, place a hold on it, and it will be waiting for you at your favorite branch. So I will stop sharing now. Just one quick thing, the views and opinions expressed in this program are those of the presenter and do not necessarily reflect the official policy of Jackson County Library Services. Our speaker today is Janice Jasinski. Am I saying that right? Okay. Janice took an early retirement from Hewlett-Packard in 2012 after 28 years of contributions across the HP business geographies and functions. After retirement, she joined Portland, Oregon Encore Fellows Program and worked for 16 months with Gateway to College, a national nonprofit whose program enabled at-risk youth to complete high school and continue college. Since then, Janice has contributed her finance and operations skills to several nonprofits in the Portland area. Elder care and dementia care and education are areas of passion for Janice. She cared for her mom who had Alzheimer's and saw the challenges and heartache firsthand. This sparked her connection with the Alzheimer's Association, where she's been raising both money and awareness for 10 years. She's been trained to deliver Alzheimer's outreach and classes to educate the public on the issues of Alzheimer's. Janice also teaches a class on assisting aging loved ones through the Clark Economic and Community Development Program. Thank you, Janice, for joining us, and I will hand it over to you now.
Thanks so much for inviting the Alzheimer's Association, and thank you to all of you who are joining us, wanting to learn more about Alzheimer's and other dementias. I hope you find this program really valuable. for you. So as said, my mom she had actually Alzheimer's and vascular dementia. And I watched my dad care for her. They lived in Texas and, saw firsthand how difficult it was for him, an elder man as a caregiver. And, but it's hard for anyone. And then my dad passed and I moved my mom I live in Southwest Washington, moved her here. And that was the beginning of my journey with her. And it was an honor to be able to be with her. I wish I knew so much then that I do now. And so I really admire anyone who's getting their education on this early on. I'm going to share. Feel free to ask questions anytime. You can just unmute or use the chat, and or even comments, if you have comments or things that you want to add, we can all learn from that. So, all right. So I'm going to get going on this. And are we ending? Just want to make sure I know, is it noon end?
Yes, we've allotted an hour. If we go over a little bit, or under a little bit, that's fine too.
Okay. Thank you. Just wanted to make sure. Sometimes they're scheduled for an hour, sometimes an hour and a half, and I wasn't certain. So, okay. So these are the things that we're going to talk about today. We'll talk a little bit about Alzheimer's versus dementia, because that can be really confusing. Are they the same? Are they different? We'll also talk about the science around how Alzheimer's impacts the brain. We'll touch on risk factors of Alzheimer's disease. Again, they're risks. They're not, if you have or do this, you get this. There's a few things that may do that, a few genetic, but they're rare. And then we'll talk about the 3 stages of the disease, so that you understand kind of the progression to be expected. We'll touch on the FDA-approved treatments for the symptoms of the disease. Talk a little bit about the clinical trials and some of the efforts that are going on in research today. And then I'll close with sharing with you the resources, the free resources that are available from the Alzheimer's Association to help you. All right, so the way this program's set up, we do have a couple of questions, and I'll pause for just a second. You can unmute and take a guess. Otherwise, I'll just kind of keep moving through. But, some of you may know people who have dementia, and others may not. So we'll see how we go with these questions. So it is a global crisis. And like I said, some of you may know more, but how many Americans do you think are currently living with Alzheimer's disease? Any guesses? I will let you know then. So we're actually now, this presentation is probably about 4 years old. So we're a little over 6 million now. So 6 million Americans living with Alzheimer's. If the research doesn't yield developments in prevention or treatment, that number is projected to reach 14 million by 2050. And part of that is just that our population is aging. We'll have well over 20% of the population above 65 by 2050. So here's another question. Oh, and around the world, that 6 million is about 50 million. So another question is, how many unpaid Alzheimer's caregivers are there in the United States? And this one actually has been revised in the last few years. It used to be this 16.2 million, but they've, with some data that has been improved since that survey was taken, they're now estimating that number lower at closer to 11 million. So that obviously implies that there's more than one person often caring for someone when the care is being given at home. And it really impacts people so much, so more than 80% of care is provided at home for people who have Alzheimer's or other dementia. And that's by family members, friends, other unpaid caregivers. And about half of those caregivers who are employed report having to go in late or take time off or quit altogether due to the demands of caregiving. So it has a huge financial impact on households in terms of, lost wages and cost of care. We're going to listen to a short video around some of the facts behind Alzheimer's disease. Okay, so in this next section, we will talk a little bit about Alzheimer's and dementia. Those terms are used interchangeably, but they're related, but they're different. So we'll talk through that. But before we begin that, we just have a couple of other questions to get some of these facts out. So true or false, Alzheimer's is a normal part of the aging process. Any guesses? The answer is false. So Alzheimer's is much more than just memory loss. It's a progressive and fatal brain disease that kills nerves and tissue in the brain. And it affects a person's, over time, their entire being, memory, thinking, behavior, their ability to function. If it was a normal part of aging, everyone would get it. And we know that's not true. And then another question, true or false, people younger than 65 can get Alzheimer's. That is true. So we have approximately 200,000 Americans under age 65. They have a form of Alzheimer's called younger onset or early onset Alzheimer's. And with this kind of disease, symptoms are often beginning for a person in their 40s or 50s. And it creates a whole new set of challenges when someone develops it at these kind of young ages. I think that we have, you may have heard, some of the early onset is a very genetic form. And there's a family you may have heard of that lives in Colombia, and half of the family members develop Alzheimer's in their 40s. And that family has been, incredibly generous to, many of them to donate their time and take testing and that as part of a large clinical trial that have helped us learn a lot about Alzheimer's disease. That's a younger onset form. So we're going to hear from an expert now. It's Dr. Heather Snyder, and she's going to talk to us a little bit about dementia and Alzheimer's.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. and frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So I like to just say a few more things about that, because dementia itself is defined as a loss of cognitive functioning significant enough to impact everyday living. And there are many conditions and situations that can cause dementia-like symptoms. So confusion, loss of some functionality. Many conditions can cause dementia-like symptoms. What Dr. Heather Snyder shared with you are the most common specific dementia diseases. So those are progressive dementia diseases, Alzheimer's being most common. But even things such as a urinary tract infection or dehydration or medication interactions, all of which are very common in people as we age, those things can give almost dementia-like symptoms of confusion, etc. That's why it's so important to get diagnosis and not assume it's something that maybe you can't do something about, right? So we really encourage diagnosis. We have a great class called Know the 10 Signs that goes into that in more detail. But we're going to hear now about why an accurate diagnosis about a specific dementia disease can be helpful.
Certainly, having the diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
Okay, so any questions about that section? Questions about dementia versus Alzheimer's, etc.? All righty. So as we talked about, dementia, it's a general term. It's symptoms that disrupt cognitive functioning, and they're severe enough to interfere with daily life. And Alzheimer's is the most common dementia disease, cause of dementia. Actually, what they're finding is that often there are combinations of dementias that a person will have. My mom, Alzheimer's and vascular dementia. So many times they're in this mixed dementia mode. And that Alzheimer's is not a normal part of aging. It's a progressive brain disease. All right, our next section, we're going to learn a little bit more about the science behind Alzheimer's. So the brain, even though it's small, it is mighty, it is the command central of our body. It is nourished by the richest vascular network in the body. In fact, 25% of the blood that's moved each time your heart beats goes to nourish your brain. So we're going to hear from one of our experts now, and he's going to talk about how Alzheimer's disease impacts the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So you heard Dr. Hartley talk about this, and I think to me that was one of the things that was just the hardest about Alzheimer's and watching my mom with that. And I know it was difficult for my dad because, you know, my mom looked the same on the outside. It just looked like my mom. She still smiled like my mom. But it's important that we as caregivers understand how compromised their brain becomes as a result of this disease. That brain shrinkage, I mean, that is impacting, you know, methodically as it moves through the brain, different areas. And so a person cannot respond the way they used to respond. They can't try harder, you know, so we as the caregivers or the family members, we need to change how we approach and interact with our loved ones to continue to have successful communication with them. And I'm going to make one other plug because we have a class called Effective Communications, and it is a great class. If your loved one has Alzheimer's, it can help you to learn how to be able to connect with them at every stage of the disease. Because again, it's us who has to change. They can't. So to kind of summarize that section, we talked, oh, did I pass that up? Where'd that go? No? All righty. Well, I will summarize. More than 100 years ago, Dr. Alois Alzheimer's, he described what Alzheimer's was and the changes in the brain, the formation of these plaques and tangles that we believe are what are cutting the communications and killing brain cells. And all those brain changes, that is what leads to the results you see, the reason a person can't remember things or you know, function the way they used to. Crazy things can be forgotten. I mean, my mom forgot how to wash her face. She didn't know where the silverware drawer was. It had been the same place forever. It's hard to fathom sometimes, but that's what happens with this disease. And each of those different dementia diseases, they work their way through the brain a bit differently, but they are all progressive diseases. Okay, now we're going to shift gears and talk about risk factors. Let me pause a sec. Was there anybody who had a question about that section? All right, if you're asking a question, you must be on mute. So don't forget to unmute if you need to ask a question. Okay, I'm going to go in and talk about risk factors. And so, you know, all of us are at risk of developing Alzheimer's, but we do have some factors that we know increase a person's risk of developing Alzheimer's disease. So we're going to start with a little quiz again. So these are all risk factors, but which do you think is the greatest known risk factor for Alzheimer's disease? Any guesses?
Age.
Yes, yes, it is. Thank you. It is age, which, you know, is a bit stunning and sad because, of course, we can't do anything about that at all. So even though it's not a part of normal aging, as we've discussed, it is the greatest risk factor. This is a disease that typically comes on later in life. After age 65, the risk doubles every 5 years. And by the time someone's 85, they have a 32% chance that they will have Alzheimer's disease. So it increases with age, but all of these are factors. I like to mention, because this presentation doesn't go into all the risks of Alzheimer's disease. And again, a risk doesn't mean a causal relationship, right? It doesn't mean this leads to this, but it means it increases your risk. There's a high correlation. And so one that I really feel is important to mention, because it is one you can do something about, is what we call the body-brain connection. So in general, or the heart-brain, what's good for the heart is good for the brain. And that's because, like we talked about, your brain is nourished by this vascular network. So anything, any diseases that impact the cardiovascular system, they're going to be associated with a higher risk of Alzheimer's. So I'm talking about things like diabetes and heart disease and stroke. Those are some of the biggest ones. So if we know we have those issues, then we can work to control those. And that in turn helps us, to lower risk for, Alzheimer's and other types of dementia. So that's a really important risk factor. Head injury is another one. And as we know, as we age, falls become a much greater risk. So really important to do what we can to prevent falls, protect our heads, especially if we're doing things like bicycling and so forth. Okay, we're going to hear now from Dr. Snyder again, and she is going to talk to us about those risk factors.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So before I talk about this slide, I just want to say a few things about that, and particularly about the genetic piece. So again, that deterministic gene is rare, but there is one, a lot of times it's associated with early onset. But if a family has that, they generally know, because, many of the family members are developing the disease. More common is the risk gene. And in that risk gene, they've identified a gene, the APOE4 gene, and a person can have 0 copies of that, or they could have inherited one from one parent, or they could have 2 copies if they inherited from both parents. And then your risk increases based upon the number of copies. But again, it doesn't guarantee. They've also begun to discover some genes that might have some protection value as well. So that's late, more of the latest genetic research that's going on. So we hope we can learn more about that and hopefully capitalize on that in the future. But I want to say a few things about these populations at higher risk. So you can see the facts and numbers here, but Hispanics 1.5 times as likely to develop Alzheimer's. African Americans 2x as likely to develop versus their white counterparts. And then women, 2/3 of the Americans with Alzheimer's are women. So there's a lot of research being done into these areas to understand, what drives this. Right now, there's theories, and so we know, like, for example, that both Hispanic and African Americans are more likely to have some of the cardiovascular issues. So that can be part of what's driving their numbers up. Where there's things being looked at from a biology and hormonal standpoint with women. We do know women live slightly longer than men, but even after you correct for that, there's many more women who develop the disease. And it's just disproportionately on women because in general, more of the caregivers are women too. So a disease that's really difficult, for everyone, and particularly for these populations. Okay, were there any questions about that? So we talked about age being the greatest known risk factor and that the risk increases after age 65, family history as well. We talked about the risk and deterministic genes, and then the populations that are at an increased risk.
So I have a question.
Yeah.
Are there tests that people can have done to say, yes, you have these deterministic or risk genes? And are there benefits to having those tests done?
There are tests that can check. Before you would decide to do any of that kind of genetic testing, it's always good to talk to like a genetic counselor, somebody who has expertise on that, making sure that you understand any ramifications. I mean, today there wouldn't be an issue from an insurance perspective, but that could change, who knows? So you want to make sure you understand that. I think, benefit wise, to know you have that's a personal choice. And that's what a genetic counselor, I think, is going to talk to you about. It's just like people deciding, for the breast cancer gene or other things like that. It might, if that's something that would be comforting to you to either know yes or no, again, it might just be a risk gene. So that's not going to tell you anything conclusively. The best thing is for us to just take as good a care of our health as we can and to plan, to make plans for the future, because no matter what, whether it's Alzheimer's or anything else, as we age, we need to make sure that, we have kind of financial and care plans and things in place. That's what can give us best peace of mind. That's my thought. Did that help? Does that answer? And any other questions? Okay. Then I'll keep us going here. So our next is we're going to talk about the stages of Alzheimer's disease. And so it's really hard to sometimes describe progression of Alzheimer's disease. We can do that in a generic way, but it is very unique for every individual. I mean, we often say, if I've seen one person with Alzheimer's, I've seen one person with Alzheimer's. And a lot of that is because the disease impacts us late in life when we already have a number of other health issues potentially. So it can kind of work its way through each person differently. And again, there's different types of dementia diseases. So we're going to hear a little bit from our expert, Dr. James Hendricks, and he's going to talk about why this is the case.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease as they age, but we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
And now we're going to get to hear from 4 people who have different types of, progressive brain diseases, different forms of dementia diseases. And they're going to talk a little bit about how it feels. So the first one's called a different kind of forgetting.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel. So I've even stopped trying.
And losing the words.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
And facing the frustration.
I'm like an overachiever. And when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
And living for today.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor's, and so that becomes a little disconcerting at times to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
So I think it's really important to hear from people who have the disease. Obviously, those folks are in the early stages of the disease, but, you know, and they're very aware of their declining capabilities. So that is not the case with everyone. There's probably about half of folks who have Alzheimer's or other dementias who aren't really aware of it. And, you know, that can be a simple denial, but often it's because it's where it is in their brain. They don't realize that they're having problems. And so, you know, people respond and act different ways. But so those were early stage, but symptoms worsen over time for everyone. But again, the way they progress through it might be different. And on average, a person who has Alzheimer's lives for 4 to 8 years after diagnosis, but they can live as long as 20 years. And again, depending upon other underlying conditions and so forth. So now we're going to hear from Dr. Snyder again, and she's going to talk about the 3 stages.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So, I mean, things, again, in that early stage, you might start to have trouble with areas that used to be reliable. You know, being able to cook a recipe that you've done before, things, you know, asking the same questions over and over again. Those are signs. And a lot of people start to have problems with numbers in the early stage. You know, again, these are all in general. But that middle stage, that's when language problems really become more pronounced. So not just the inability to remember a word, but it becomes deeper than that. It becomes, people tend to speak less because the thought comes in their head and then it leaves them. And they also begin to have more trouble understanding words. So again, really important that we learn how to communicate in all these stages. When words go away, people begin to act out more with behavior. And so anger or anxiety or frustration, those things can really begin to show up more. And in the late stage, a person really doesn't do much anymore, but there are still ways to connect to your loved one in that late stage. So any questions about that? Go to our summary. You know, we talked about those 3 stages. Reiterate again, nobody experiences the symptoms and progression in the same way, but symptoms will worsen over time. So any questions there? All right, we'll shift into treatment and what's been approved. So we've got another quiz here. We have true or false. There are several drugs available to slow down the progression of Alzheimer's disease. Any guesses?
False.
False, that is false. There are some medications that are out there, but they only address symptoms of the disease. There is nothing yet that can prevent, treat, or slow Alzheimer's disease. Now, we did just have, since this presentation was done, a new drug approved. But it's in people with very early on, it has shown some progress. So, you know, again, I think this slide will be updated, but it's not being touted by any means as, you know, as a cure for the disease, but it can help perhaps to slow it. And we'll talk a little bit about that. So we're going to hear from some experts here, and we're going to talk about the treatments that are out there.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
So those are the drugs that as of a couple of years ago that were approved. This year there was another one, aducanumab, that has been recently approved. And that drug has all these that are on the screen are going after kind of the chemical messengers in the brain, and they support that. So for some people, they can help you have more good days and bad days. The aducanumab is the first drug that's actually going after the beta amyloid in the brain, which are what they call the plaques. So you may have heard of plaques and tangles, and they're clumps of proteins that are blocking the transmission of information in the brain. And so, but this new drug has only been tested in people who have very mild Alzheimer's disease. And so that we have no evidence that it will work yet in people who have, kind of middle stage or beyond. And it showed a 1 to 2 point reduction in Alzheimer's disease symptoms versus the placebo. So I think it's a good start for us, but not necessarily, it's not going to be the end all, but it's a start. Questions about that? So I think our recap then, we talked about those 3 types. I mentioned the new drug that's out there. And again, these in this presentation are only treat the symptoms. I know my mom was on, she was before they combined the 2 drugs. And so she had Aricept and Namenda. And I do think it helped her. I think it supported the memory, but again, it only works for a period of time, and it doesn't work for everyone. All right, so now we're going to shift and talk about research. And in the last decade, we have made some enormous strides in understanding how Alzheimer's disease and other dementias affect the brain. And a lot of that research has given us insights that give us some, very promising strategies for treatment, prevention, and diagnosis. And if we're able to find a way to delay the disease, just delay it by 5 years. Again, this is a disease that people get when they're older. By 2050, 5.7 million Americans would not get Alzheimer's disease in their lifetime. So really important. I think most of the research now is really looking at prevention and delay. So we're going to hear about some of those things. And we'll start with investigating early intervention.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point And when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
So that is very exciting. And now they're able to see plaques and tangles, and they know, which is a little scary, but also, good progression for us from a research perspective. But they know that those plaques and tangles are starting 10, 15 years before symptoms even begin. And so, but today the ways of seeing those are either very expensive or a little invasive, but they're working on other types of biomarkers, other tests that can find those biomarkers. So that not only helps us with targeting people for prevention, but it also helps us if we're going to test certain drugs. Like if we were trying to test a drug that removes plaque from the brain, but we didn't know if a person had plaque to begin with. See what I'm saying? It helps us with that too. So pretty exciting. Exploring lifestyle factors.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past are things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
So there was a very important study that was done in Finland, the Pointer study, and it took people on an individual basis on different dimensions and, made their lifestyles healthier. And, they do blood work, you're low in this, and they tweaked them. So it was very individual. And that study and it showed improvements for people's cognitive abilities. So they are doing that in many other countries right now. The US, I think, maybe has done, bringing people into their clinical trial. And then moving toward a cure.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
And securing the funds.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
So as you've heard, there's a lot of hope for where we're headed with research in Alzheimer's disease and other dementias. And one of the key ways we keep that moving is through clinical studies. Besides funding, the greatest barrier to successful research is recruiting and retaining people for clinical trials. There's a number of them that are underway. I'm going to hear a little bit more about that.
More important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even a cure.
And then here's a service through the Alzheimer's Association that can help people find studies.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
So, I mean, I'll say I've joined Trial Match as a healthy, person. And, right now, the types of things I'm doing are more like online brain game type things and questionnaires about lifestyle and so forth. Every quarter, a couple of these studies come back. I go back in, I do my tests. And, they're gathering information from me. There are some others that, when you sign up, it's just a little bit of information, but then every study you might be eligible for, they will present them to you and you just can look at them and decide if you want to do it or not. There's no obligation. There's some that I've looked at and said, no, I'm not going to do that. And there's some that I've said, yeah, I can help there. So it's kind of interesting and, really an important for research. And then last, here's a recap. So I think we've talked through all this already, but lots of research that's been happening. We've learned a lot. And that we really need people living with dementia. We need people to join clinical studies. We need diverse populations to join clinical studies as well. And Trial Match is a place where you can do that. And so I want to close just covering some of the resources. Alzheimer's is such a difficult disease. It's a long disease, but nobody has to face this disease alone. The Alzheimer's Association is here to help. And I really encourage you, if your loved one has Alzheimer's, to take advantage of the services we have. So, our mission is really care, support, and research. We want to eliminate Alzheimer's disease. So a big portion of funds go to research and a good portion of funds go to care and support of people who have the disease and their caregivers. So let me just share a couple of things, just a few of the things that are out there. So I guess I'll start with the middle one, the website, alz.org. Such a wealth of information. That's where I first went when my mom was diagnosed. But you can learn a lot about Alzheimer's and other dementias. They have sections if you have the disease yourself, if you're a caregiver. There's just so many tools and information out there, for caregivers and for people who have the disease. Also, we have that 24/7 helpline that's available, at any time. So if you're caring for a loved one, a situation arises and you just don't know what to do, that's a number to call. It's staffed by master level clinicians. They have help in over 200 languages, but that can be a great place to, find out what you might do. Your loved one, you can't get them to take a shower, or it's time to stop driving, those types, anything. And then we have support groups. We have these education programs. They're webinar education programs that are available. You can find those on the website, or they even have the classes kind of, pre-recorded, so you can watch them at any time. They're not live. And then we have this alz.org/CRF, which is our community resource finder. So, there's a lot of services you may need that are beyond what the Alzheimer's Association provides. There's other great resources like Area Office on Aging and so forth. But we also have a guide where you can go in if you're looking for housing, or you're looking for, food, or, whatever, low income. You can put those things into this search engine and it'll help you there too. So that's what I have to share with you today. I'm going to stop sharing. Thanks so much for attending. I hope you found this valuable. I wish you all the best on your journey as a person who is interested in Alzheimer's and dementia, probably because someone you know.
Thank you so much, Janice. We really appreciate you taking the time to speak with us all about this really important topic, and the work that you do with the Alzheimer's Association. We just appreciate you.
You're welcome. Glad I could be here. Thanks for inviting me.